If you have diabetes, irreversible changes are happening in your body right now. At this very moment, here's a shocking statistic officially released by the global medical community. Between 52.5% and 66% of men with diabetes experience erectile problems. That's 3.5 times higher than men without diabetes. Here's what's even more shocking. 33% of men diagnosed with diabetes, that's 1 in 3, already have declining erectile function at the moment of diagnosis. And after 6 years from diagnosis, more than half will face this problem. These numbers come from a meta-analysis of 145 studies published in the World's Medical Database, covering 88,577 men. Mayo Clinic, Harvard Medical School, NHS, UK, the world's most authoritative medical institutions are all issuing the same warning. A population-based study in Singapore revealed even more specific numbers. 42.8% of diabetic men in their 40s experienced erectile dysfunction. But in their 60s, this number skyrockets to 77.4%. Among those over 70, 77% suffer from severe erectile dysfunction. Research from Japan is even more alarming. Between 60% and 90% of Japanese diabetic patients reported erectile problems. That's twice the rate of men without diabetes. Looking at Asia as a whole, the age-standardized prevalence of erectile dysfunction is 36.8%. But when you look only at diabetic patients, this number more than doubles. You might be thinking right now, I'm still okay. But this is the most dangerous misconception, because erectile dysfunction doesn't come suddenly. There's a destructive process happening in your blood vessels, right now quietly but surely. By the time you start noticing, it's likely already significantly advanced. The European Association of Urology's 2025 latest guidelines warn all adult men with diabetes should undergo regular screening for sexual function. This isn't just a recommendation. This is the conclusion drawn by urologists worldwide. Based on decades of clinical experience and research, here's what's even scarier. Erectile dysfunction isn't simply a problem with your intimate life. It could be an early warning signal from your heart. Research published in the British Medical Journal states, diabetic patients with erectile dysfunction have a significantly higher risk of experiencing cardiovascular events within 2 to 5 years. Watching this video to the end is the first step in protecting your health, because you can only prevent what you know about, and you can only recover if you prevent it. The first destructive process happening in your body right now is blood vessel damage, and this is the starting point of all problems. Male erections are fundamentally a vascular issue. When sexually stimulated, small arteries in the penis expand, and blood fills the sponge-like tissue called the corpus cavernosum, causing an erection. For this entire process to work perfectly, healthy blood vessels are essential. But when high blood sugar persists, 4 deadly changes occur in your blood vessels. First, your vessels start rusting from the inside. High blood sugar creates excessive free radicals, toxic substances in your body. It's like iron rusting when exposed to air. These toxins damage your vessel walls from within. According to research published in the World's Medical Database, the levels of these toxic substances in the inner vessel cells of diabetic patients were more than 3 times higher than normal. Second, the substance that widens blood vessels decreases. Our bodies have a substance called nitric oxide, which is the most important substance for expanding blood vessels. Without it, erections are impossible. But in high blood sugar conditions, the factory that produces this substance doesn't work properly. Harvard Medical School researchers found that nitric oxide levels in penile tissue of diabetic patients drop below 60% of normal levels. Third, debris accumulates in the vessels. This is called advanced glycation end products. Simply put, toxic debris created when blood sugar tangles with proteins. This debris accumulates on vessel walls, making them stiff and losing their elasticity. Like an old rubber hose becoming hard and cracking, your vessels are undergoing the same process. Fourth, the inner vessel walls become rough. According to Mayo Clinic research, when examining penile arteries of diabetic patients under a special microscope, the inner walls showed severe damage. Normal vessel interiors are smooth and flat, but diabetic patients' vessels are bumpy and rough, with wounds observed everywhere. Here's the scariest fact: the diameter of arteries going to the penis is 1 to 2 millimeters. Meanwhile, the diameter of arteries going to the heart is 3 to 4 millimeters. Think of it as a thin straw versus a thick straw. If the same amount of debris accumulates, the thin straw clogs first. Then the thick straw clogs. Assume the same amount of vessel damage exists. Small penile arteries clog first and symptoms appear. Then larger cardiac arteries show symptoms. What does this mean? Erectile dysfunction is an early warning sign that appears 2 to 5 years before a heart attack. Research published in the British Medical Journal calls this the artery size hypothesis. Because problems appear in order from small to large vessels, erectile dysfunction is described as the canary in the coal mine for cardiovascular disease. Your blood vessels are being damaged at this very moment, and this is just the beginning. Blood vessel damage alone is serious enough, but diabetes doesn't stop there. A second destructive process, nerve damage, progresses simultaneously. Diabetic neuropathy, simply put, nerve damage caused by diabetes, is one of the most common complications of diabetes, and its impact on male function is devastating. For an erection to occur, signals starting from the brain must be accurately transmitted through the spine to the penis. If any part of this signal pathway is damaged, erections become impossible. Research teams at Wakayama Medical University in Japan measured nerve signal transmission speed in 82 diabetic patients. The results were shocking. In patients with erectile dysfunction, nerve signal transmission speed was significantly slower, and damage to the autonomic nervous system nerves you can't consciously control was severe. The autonomic nervous system controls body functions. You can't consciously regulate heartbeat, blood pressure, digestion, and erections. When high blood sugar persists, these autonomic nerves break down one by one. The study found that patients with orthostatic hypertension, simply put, feeling dizzy when suddenly standing up, had more severe erectile dysfunction, because both are symptoms of autonomic nerve damage. More specifically, erectile dysfunction rates skyrocketed in patients whose heart rate couldn't flexibly change with circumstances. This means the body's automatic control function has declined. But it doesn't end here. A third destructive process, male hormone changes, is added. Surprisingly, 30% to 40% of type 2 diabetic patients have hypogonadism, simply put, a deficiency in the male hormone testosterone. This is much higher than in average men. Diabetes Canada's clinical practice guidelines explain the biggest cause of low testosterone levels in diabetic patients is deep abdominal visceral fat and insulin resistance. The more deep visceral fat, the more an enzyme called aromatase is produced. This enzyme converts the male hormone testosterone into the female hormone estrogen. As a result, male hormones decrease while female hormones increase. Additionally, insulin resistance, when insulin doesn't work properly, reduces the protein that transports sex hormones. This lowers measured testosterone levels and also decreases biologically active testosterone. When testosterone is deficient, sexual desire decreases, erection quality drops, and overall sexual function declines. And this triggers depression and anxiety again. What's scariest here is that all these processes create a vicious cycle. Blood vessel damage, erectile dysfunction, depression, reduced exercise, weight gain, worsened blood sugar control, more severe blood vessel damage, nerve damage, reduced sensation, decreased sexual stimulation, reduced hormone secretion, more severe nerve damage, hormone decrease, muscle loss, metabolic decline, increased insulin resistance, more severe hormone decrease. These three destructive processes don't operate independently. They influence each other and worsen the situation. And as time passes, this vicious cycle accelerates. What I'm about to tell you is the most important part of this video, because it's information that could save your life. Erectile dysfunction isn't simply a problem with intimate life. It's the last warning signal your heart is sending. There's a large-scale study conducted at Mayo Clinic. After tracking more than 88,000 men, the results showed that diabetic patients with erectile dysfunction had a 50% increased risk of coronary artery disease, and in younger patients under 45, this risk was even higher. Here's an even scarier statistic. The COBRA study, published in the European Heart Journal, directly confirmed the relationship between erectile dysfunction and coronary artery disease. Research teams performed coronary angiography on patients with erectile dysfunction. The results were shocking. Many of them already had severe coronary artery stenosis, meaning vessels were significantly narrowed but had no symptoms like chest pain. This is called silent myocardial ischemia, silent heart disease. You feel nothing, but your heart vessels may already be dangerously blocked. Why does erectile dysfunction appear first? Because of the vessel size difference I mentioned earlier. Penile arteries 1-2 mm, coronary arteries 3-4 mm. If the same atherosclerosis, the same plaque accumulation exists, small vessels clog first. Research published in the British Medical Journal presents an even more specific timeline. Within an average of 2 to 5 years after erectile dysfunction appears, the risk of cardiovascular events increases sharply. Think about it. 2 to 5 years. This is your golden time, your last chance to respond. The Princeton III Consensus, a consensus document from World Cardiologists, strongly recommends that all diabetic patients with erectile dysfunction receive cardiovascular risk assessment. This isn't optional. It's mandatory. Data from the Asia-Pacific region sends the same warning. According to Asia-Pacific cohort studies, cardiovascular disease accounts for 42% of major causes of death in Asian diabetic patients, and especially stroke, when brain vessels are blocked or burst, shows high rates. When diabetic patients have erectile dysfunction, it means three things. First, your vessel inner walls are already damaged. This damage is happening simultaneously in vessels throughout your body. Second, the ability to produce substances that widen vessels has declined. This means vessels can't expand when needed. Third, atherosclerosis debris accumulating in vessels is progressing. Plaque is building up, vessels are narrowing, and they could completely block someday. NHS UK guidelines are clear. All diabetic patients with erectile dysfunction should be assessed for cardiovascular risk factors and, if necessary, referred to cardiologists. Here's the most important message: don't be ashamed or hide erectile dysfunction. This isn't a shameful problem. This is your heart crying for help. If you're experiencing erectile dysfunction now, this is more than just uncomfortable intimate life. This is a warning that you could have a heart attack or stroke within 2 to 5 years. Act right now. There's no time. Most men think erectile dysfunction comes suddenly. They think function just stops one day. But that's not true. Erectile dysfunction approaches quietly, slowly, but surely. And your body has been sending signals for a long time. The first signal is a change in erection quality. It's not as firm as before. Previously, it was completely firm, but now it's only 70% to 80% firm. Many men think this is just aging and move on. But this is the first warning that vascular function is declining. The second signal is difficulty maintaining erections. Initially, erections occur well, but gradually weaken over time. erections disappear midway. This is a signal that the corpus cavernosum, the sponge-like tissue that stores blood, is losing capacity. The third signal is decreased morning erections. Healthy men naturally experience erections multiple times during the night. This is an indicator of vascular health. If the number of times you notice morning erections per week decreases, this is a serious signal. The fourth signal is changes in sexual desire. For diabetic patients, testosterone, the male hormone, may decrease along with sexual urges, but many men attribute this to stress or fatigue. The fifth signal is changes in ejaculation. Time to reach ejaculation lengthens, orgasm intensity weakens, or ejaculation volume decreases. This could be a sign of nerve damage. Research at Wakayama Medical University in Japan discovered an important fact. Diabetic patients with erectile dysfunction also reported other symptoms: leg paresthesia, numbness, burning, or tingling. This is peripheral neuropathy, nerve damage in extremities, and these patients had more severe erectile dysfunction because the same nerve damage affected nerves involved in erections. Urinary problems, frequent urination, or incomplete bladder emptying. Because the autonomic nervous system also controls bladder function, bladder symptoms and erectile dysfunction often appear together. Insomnia and loss of appetite also accompanied. This indicates overall autonomic nervous system imbalance. Changes in heart rate or blood pressure are also important signals. If you feel dizzy when suddenly standing, or heart rate recovery after exercise is slow, this is a sign of autonomic nerve function decline and simultaneously a risk factor for erectile dysfunction. Here's the saddest fact: most men ignore or hide these signals. According to surveys by Singapore Health, among men experiencing erectile dysfunction, less than 30% actually consult doctors. The remaining 70% feel ashamed, think it's just aging, or give up thinking it can't be treated. But this is a fatal mistake, because if you detect and take action early, recovery chances are much higher. If you're experiencing 3 or more of these symptoms now, don't delay anymore. This could be the last warning your body sends. If you've listened this far, you might feel scared and hopeless. But from now on is the really important part. The message of hope: erectile dysfunction caused by diabetes is recoverable. Medical research worldwide has proven this. And the first thing to do is blood sugar management. Cleveland Clinic researchers made an amazing discovery. Patients who maintained HbA1c, the average blood sugar level, over the past 3 months below 7%, had significantly lower rates of erectile dysfunction. And even patients who already had erectile dysfunction improved when they controlled blood sugar well. Specifically, what should you do? First, thoroughly check blood sugar. Goals are fasting blood sugar measured upon waking below 100, post-meal blood sugar after 2 hours below 140, and HbA1c below 7%. These aren't just numbers. They're lifelines protecting your blood vessels. Second, exercise. But not just any exercise. According to research published in European Urology, diabetic patients who performed moderate-intensity aerobic exercise 5 times per week, 30 minutes or more each time, showed significant improvement in male function. Why is exercise effective? Exercise helps in 3 ways. First, it improves inner vessel wall cell function. Regular exercise increases production of substances that widen vessels and restores vessels' ability to expand when needed. Second, it improves insulin sensitivity. Simply put, muscles absorb sugar better, stabilizing blood sugar. Third, it increases testosterone, the male hormone. Especially when combined with resistance training, weight or dumbbell strength training effects are greater. The specific exercise prescription is this: 5 times per week, brisk walking 30 minutes, and 2 to 3 times per week, full body strength training 20 to 30 minutes. Continuing this for 12 weeks, male function scores improved by an average of 30% or more, according to research. Third, weight management. Maintain BMI obesity calculated from height and weight below 25, and especially reducing deep visceral fat is key. Research shows testosterone increases with each kilogram of visceral fat lost, and when visceral fat decreases, insulin resistance improves and inflammation levels decrease. Fourth, dietary improvement. The Mediterranean diet meals centered on fresh vegetables, fruits, fish, nuts, and olive oil is most effective. According to research published in the British Medical Journal, diabetic patients following the Mediterranean diet showed remarkable improvement in vascular endothelial function, inner vessel wall health, and male function improved together. Foods to avoid: processed meat, trans fats, refined carbohydrates, white rice, white bread, sugary drinks. These foods rapidly raise blood sugar and cause inflammation in vessels. Fifth, quit smoking. This is non-negotiable. Smoking constricts vessels, damages inner vessel walls, and is an independent risk factor for erectile dysfunction. Male function can improve just from quitting smoking. Sixth, limit alcohol. Moderate drinking of 1-2 drinks per day is okay, but excessive drinking interferes with testosterone production and worsens nerve damage. Start all these lifestyle improvements within 72 hours. Starting today versus tomorrow versus a week later creates completely different results. Sometimes lifestyle improvements alone aren't enough. That's when medical treatment is needed. And this isn't shameful. The first treatment option is phosphodiesterase type 5 inhibitors, simply put, blood flow enhancers. Medications like Viagra and Cialis belong here. Let me explain how these medications work. For erections to occur, the corpus cavernosum smooth muscle, soft muscle, must relax. When this muscle relaxes, vessels widen and blood enters, causing erections. But diabetic patients have problems with this relaxation process. Blood flow enhancers help this relaxation. They help erections occur by increasing blood flow to the penis. How effective are they? According to Mayo Clinic research, 50% to 88% of diabetic patients saw results, much higher success rates than you'd think. There's an important precaution. If you're taking angina medications, nitroglycerin, or nitrate drugs, you must never take these blood flow enhancers. Blood pressure could drop sharply, endangering life. Always consult your doctor. The second treatment option is penile injections, a method of directly injecting a medication called alprostadil into the penis. It might sound scary, but actually uses very fine needles with almost no pain. This method is second-line treatment for patients who didn't see results with blood flow enhancers. Success rates are very high. Most patients see results when appropriate dosage is found. The third treatment option is urethral suppositories, a method of directly inserting medication into the urethra, the hole where urine comes out. Can be an alternative for those uncomfortable with injections. The fourth treatment option is vacuum erection devices, a method using a vacuum pump to draw blood into the penis, then placing a ring to prevent blood from escaping. Because it's a mechanical method of creating erections without drugs, it's a good choice for those worried about drug side effects. Fifth is hormone therapy. Applies when there's a deficiency in the male hormone testosterone. According to Diabetes Canada guidelines, 30–40% of type 2 diabetic patients have testosterone deficiency. After measuring hormone levels through blood tests, if deficient, hormone replacement therapy can be considered. Testosterone therapy increases sexual desire, improves erection quality, increases muscle mass, improves mood, and enhances overall quality of life. But there are precautions. You must first get a prostate exam. And during treatment, regularly check prostate-specific antigen, a prostate health indicator. Sixth is combination therapy, lifestyle improvements, blood flow enhancers, hormone therapy, together. The European Association of Urology's 2025 guidelines recommend this combination therapy Because erectile dysfunction caused by diabetes doesn't have a single cause. Because blood vessel damage, nerve damage, and hormonal changes all work together. Combination therapy, approaching from multiple directions, is most effective. NHS UK guidelines say don't give up if blood flow enhancers don't work. Adjust dosage, switch medications, or try combination therapy. You need to try at least 6-8 times to truly judge effectiveness. Seventh is psychological support. Erectile dysfunction triggers depression and anxiety, which worsens male function again. If needed, getting help from psychiatrists or sex therapy specialists is important. Most important, don't suffer alone. Consult your doctor. This is a treatable medical problem. Now, I'll summarize the key messages. 3 things you must remember. First, more than half of men with diabetes experience erectile dysfunction. This isn't your problem alone. And this isn't simply a problem with intimate life. It's an early warning signal from your heart. A warning that you could have a heart attack or stroke within 2 to 5 years. Second, this is recoverable. Through lifestyle improvements, blood sugar management, exercise, weight loss, and medical treatment if needed, you can see significant improvement. Don't give up. Third, you must act right now. Time isn't on your side. With each day delayed, vessel damage worsens, nerve damage progresses, and recovery becomes harder. Now I'll tell you the concrete action plan. Things to do within 72 hours from today. 1. Measure blood sugar. Check fasting blood sugar, post-meal blood sugar, and if possible, HbA1c. This is the first step in understanding your current state. 2. Schedule a doctor's appointment. Urology, endocrinology, or family medicine anywhere is fine. Speak honestly about symptoms and get cardiovascular risk assessment. This is mandatory, not optional. 3. Start walking 30 minutes today. Not tomorrow, today. After watching this video, go outside and walk for 30 minutes. Walk briskly, but at a pace where you can talk. 4. Make a smoking cessation plan. If smoking, contact a cessation clinic or consult your doctor about cessation aids. 5. Review your diet. Starting with tonight's dinner, switch white rice to brown rice. Add vegetable side dishes and reduce processed foods. Things to do within a month. 1. Establish a regular exercise routine. At least 5 times per week, 30 minutes or more of aerobic exercise each time, and 2 to 3 times per week of strength training for 20-30 minutes. 2. Set weight loss goals. Aim to lose 5 to 10% of current weight within 3 months. This alone significantly improves insulin resistance. 3. Recheck blood test results. Check not just blood sugar, but cholesterol, triglycerides, and testosterone levels. 4. Start treatment if needed. Discuss blood flow enhancers, hormone therapy, or other treatment options thoroughly with your doctor. Things to check after 3 months. 1. Remeasure HbA1c. Goal is below 7%. 2. Remeasure weight and waist circumference. Check if visceral fat is decreasing. 3. Evaluate male function changes. Check if morning erection frequency, erection firmness, and duration have improved. 4. Check overall health status. Confirm if energy levels, mood, and sleep quality have improved. Finally, a message I want to convey to you. You're not alone. Millions of diabetic patients worldwide face the same problem, and many of them have recovered. You don't need to give up because you're older. There are cases of improvement even in the 70s and 80s. What matters is starting. This is a quality of life issue. It's directly connected to couple relationships, self-esteem, mental health, and above all, your life. This moment can be a turning point. Before and after watching this video, your life can change. The choice is yours. If this video helped you, please like it and subscribe, and share your experiences in the comments. Your story could give hope to someone else. We support your health. You can do this.